Thank you, Matt. Well, a local ambulance company is starting a pilot program to add non-emergency house calls to its list of services.
It's called Mobile Integrated Healthcare. It's designed to help patients just home from the hospital avoid going back within 30 days. Under new healthcare reform, hospitals will face penalties for these readmissions.
Well, I rode along with Priority Ambulance to see how this program would work. Today, Priority isn't racing to the scene of an emergency in one of its ambulances. Instead, we're traveling in this Jeep, driven by EMS Director Travis Estes. We're headed to a non-emergency house call, something Estes never dreamed he'd be doing until now.
Yeah, that was something you kind of saw on TV and stuff from many years ago, and now it's kind of coming full circle.
We pull up to our destination in this Loudon County neighborhood. Estes grabs essential medical equipment for everything from a well checkup to an emergency.
Hello, how are you? Travis with Priority Ambulance.
He quickly sets up in the dining room of 95-year-old Helen Shipley.
Let's look over some of your medications. You been having any problems lately?
Not since, about a month ago I fell.
He checks Helen's blood pressure, makes sure her medications are up to date. And in the kitchen where she recently fell, Estes spots a rug that could be a hazard.
If you were to walk over, you could catch your foot on it, or you could even slide because it's very slick. And that could cause you to lose your balance and fall, which you might strike the table or might fall into the stove or even into the sink area. So why don't we look at taking this rug up and let's get rid of it.
Helen told me she's grateful for his advice.
I'm getting some new carpet for the kitchen, and I will not have the throw rugs.
This service is designed to prevent another fall and therefore another trip to the hospital for patients like Helen.
The most expensive cost to a patient currently is rehospitalization and the tests that have to go on. So if we can act as a stopgap to intervene early on with the physician's office and with the other folks that are involved in that care, home health, etc., then we can prevent that person from bouncing back.
MedStar, an EMS agency in Fort Worth, Texas, began mobile integrated healthcare in 2009. It focused on 21 patients that it transported to emergency rooms more than 2,000 times in 1 year. At a cost of nearly $963,000 in ambulance charges alone, many of these bills are uncollectible. Through house calls like this, MedStar says there were 1,000 fewer calls per year from just those 21 patients. I did a Skype interview with MedStar's Matt Zadavsky about its success. Well, Matt, in terms of savings for people like you and me, what does your program do?
Every time that system is able to prevent that readmission, we have saved Medicare, you and I, the people who are paying the cost for Medicare, $10,000 in just that one admission.
$10,000 per patient, again, each time they're not readmitted. Priority Ambulance is hopeful that with each house call like this one, our area will one day see savings. Anyway, again, we're talking about a specific group of patients who frequently use the hospital, often for their primary care. Now, right now, 33 states have approved mobile integrated health care. A Tennessee law went into effect this month, paving the way for it here. The law allows EMS agencies like Priority to provide non-emergency care. Priority Ambulance says the program should be underway here in about 6 months.